Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair, a mat and two blankets. We are going to focus on the torso, especially the thoracic region or the region of the upper back and also the upper extremities. To begin, we shall do some basic postures for the core muscles, followed by standing postures which would help the torso and the upper extremities. Obviously, they also help the lower extremities. Then we shall look at some exclusive movements for the upper trunk. Lie on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back, that should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the trunk. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms, especially when you close the eyes. You must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms, and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms. Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch of the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time. Right leg up. Fold, hold the knee. Press the knee closer to the chest. From the hands, you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg. Chain, left leg. Left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Slowly get up from the right side. Sit upright on a chair, foot parallel, turn to your right side, sit to the right side, chest and navel up, hold the top of the chair, inhale, exhale, turn. Chest up, navel up. As you exhale, turn the trunk, rotate the neck also in the direction of the twist. Breathe well. As you inhale, the abdominal cavity should expand, and as you exhale, it should contract. Keep the shoulders even, elbows closer to the trunk. As you can see, the upper back gets a good rotation in this posture. Slowly come up, change side, sit to your left side. Hold the top of the chair, inhale, exhale, turn. Watch your breathing, chest and navel up. Turn the neck also in the direction of the twist. Neck has a greater degree of rotation followed by the thoracic, while the lumbar region does not allow much of rotation. Feel the upper back muscles. Use the grip of the chair to twist the trunk better. Slowly come up. Repeat. Sit to the right side. Hold the top of the chair. Inhale, exhale, turn. Even while you twist the trunk, ensure to lift the chest up. That can happen when the scapula or the shoulder blades glide downward and move closer to the spine. So keep the chest and navel up and twist them nicely. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. You should nicely massage the intestinal organs and muscles. Slowly come up, change side, sit to your left side. Hold the top of the chair, inhale, exhale, turn. Do not hold the breath. Breathing should be slow and steady. Feel the upper back. The pelvic girdle or the hip girdle should be fixed on the chair, while the shoulder girdle should twist as much as possible. So these two are like beams connecting the muscles of the trunk, and you should learn to twist the trunk as much as possible without shrinking the length of the spinal column. slowly come up, sit upright, stand up. Using the chair, we can do some standing postures. Trikonasana, spread the legs 4 to 4.5 foot apart with the chair in between the legs. The thigh should be at the edge of the seat of the chair, both hands on the waistline, right leg 90 degrees out, left foot inside, right foot to center the left foot, left hand on the waistline, stretch your right hand, pull the kneecaps, inhale, exhale, bend onto the right side, if possible grip the right ankle joint, turn the left shoulder, turn the pelvis, and from left hand hold the top of the chair so that you can twist the shoulders back and orient the trunk properly. So using the chair helps you to align the trunk and legs in the same plane. That's very important. You should not allow the pelvis to rotate. Breathe well. Watch your upper back. Be strong on both the legs. As you inhale, slowly come up. Both hands on the waistline, change side, right foot inside, left foot 90 degrees out. The thigh, ensure that it is almost at the edge of the seat of the chair. Both hands on the waistline, left foot to center the right foot, left foot 90 degrees out. Stretch your left hand. Inhale, exhale, bend down to the left side. Hold the shin bone, if possible the ankle joint. Position the chair properly. Roll the right shoulder back. Look up. From right hand, hold the top of the chair so that you can hold the pelvis properly aligned with the trunk and the legs. Turn the neck also, look up. Both legs straight. So Trikonasana, good for the legs, the trunk. Both the lower and upper back stand to benefit in this posture. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Slowly come up, both hands on the waistline, turn the foot parallel, bring them closer, stand in Tadasana. Position the chair properly. We are going to do Uttita Parshva Konasana. Sit on the chair, right thigh aligned with the outer edge of the seat of the chair, left leg stretched, right foot at the foot of the chair, left foot turned in, right foot 90 degrees out, left hand on the waistline, press the outer edge of the left foot, pull the kneecap, now gently bend, keeping the right hand fingertips on the floor in front of the foot, grip the right upper arm and right knee, turn from left hand, hold the top of the chair so that you can position the pelvis properly. You can prevent the pelvis from getting rotated. So align the pelvis, hip and the trunk. Breathe well. Tighten the muscles of the right arm. You have to turn the left leg out so that you can press the outer edge of the foot. Press the right foot. For that you have to activate the calf muscle and the back of the thigh. Slowly come up. Change side. So shift the chair properly. Sit on the chair, keeping the left thigh aligned to the outer edge of the seat of the chair. Left foot turned 90 degrees out. Left heel to touch the foot of the chair. Stretch your right leg back, right hand on the waistline. Turn the right foot in. Pull the kneecap. Bend. Keep the left hand, fingertips on the floor. Grip the left upper arm, left knee. Turn, and from right hand hold the top of the chair and twist. Ensure that you do not push the hips into the chair. So position the hips and use the chair to turn the pelvis so that you get that alignment of bringing the plane of the trunk and legs together. Feel your breath. Feel the upper back, chest up. You have to stretch the spine. And turn the neck also. Now slowly come up. Stand upright. Position the chair such that the chair in front of you. Stand upright. We are going to do Vajrasana 1. Walk forward. Take your right leg into the chair. Left leg back. Right foot turned at 90 degrees. Left leg straight. Left foot turned as much in as possible. Hold the top of the chair. Turn. Ensure that the right and left heel are as though one by the side of the other. Use the top of the chair to twist the trunk properly. So chest should orient in the direction of the chair. For that you have to turn the pelvis properly. Left leg absolutely straight. So depending upon your height, you can keep a blanket on the chair or a blanket below the right foot to suit your height. Chest and navel up. Very important. So for that you should pull the scapulae down and closer to the spine. Breathe well. Look forward. Slowly come up. Take the right leg out of the chair. Then change side. Left leg into the chair. Right leg back. Right heel and left heel as though they are one by the side of the other. Right foot turned inward. Left foot 90 degrees out. Press the outer edge of the right foot. Hold the top of the chair. Twist the trunk properly so that the trunk is aligned in the direction of the chair. Chest and navel up. Look forward. Elbows closer to the trunk. Vajrasana 1 is very good for the muscles of the lower extremities as well as the hip and the back. The chair helps one to find a good anatomical alignment and symmetry. And one can stay longer and experience the posture better and effective using a chair. Watch your gluteal region, the hips, the lower back, the upper back. Breathe well. Slowly get up, take the left leg out. These standing postures help the lower extremities, the lumbar, pelvic and hip region, and also the upper back. Keep a folded blanket on top of the chair. We are going to try a simple backward bend for the upper back. So stand behind the chair, hips towards the chair, hold the top of the chair, flex the knee, position the upper back on top of the chair, take the foot little forward, bend back, well open the chest, relax the neck, stretch the arms up, both arms straight. Neck also relaxed, bent back, then slowly stretch both legs forward, press the foot on the floor, arms straight, legs straight. Do not hold the breath. Breathe well. Here you can see that the center of chest is well propped up. Your cardiac muscles, the lungs, they all get a good stretch. The abdominal region also gets a good stretch. The pelvis also experiences a good stretch. Feel the ribs, the rib cage, the intercostal muscles. And this is also good for the upper arms. Arms are stretched. The region of the armpit experiences a good stretch. Thus the complete thoracic cavity is greatly stimulated in this posture. Be strong on both the legs, foot parallel. The lungs and the cardiac muscles experience a good stretch. The intercostal muscles and the muscles in the ribs, the pectoral muscles, they all get a good stretch. And because of the top of the chair, the center of the chest is propped up. Take both arms up, walk in, hold the top of the chair, slowly get up. As you know, the cervical spine has 7 vertebrae, the upper back or thoracic has 12 vertebrae, the lumbar region has 5 vertebrae. We shall slightly intensify, hold the top of the chair, flex the knee, position the upper back properly, and then slightly take the foot forward, stretch the arms up and back. Now hold the seat of the chair from both hands. You can see the increase in the intensity of the stretch at the upper back. Then if possible, slowly, gently take the legs forward, straighten the legs, press the foot, foot parallel. Breathe well. Neck also needs to be hyperextended, but there should be no strain. And you can also see that the armpit region gets a good stretch, and the entire spectrum of the thoracic cage experiences an intense stretch in this posture. But do not hold the breath. Squeeze the buttocks, tighten the thigh muscles, pull the kneecap, press the foot firmly. And breathe well. So the top support should be behind the center of the chest. That's where you have to support. There's an excellent stretch. As you can see, exclusively the upper back is involved. The cardiac muscles, the fabric of the lungs, they all go through a good stretch. Now flex the knee, walk back, take both hands up, hold the top of the chair, slowly get up. In doing all these things, also ensure that you don't topple the chair. So initially it is a good idea to put the chair against the wall so that it does not relatively slide. Alternatively, keeping the chair on a mat like this would also help the chair from getting into a sort of skidding, either while going into the posture or coming back. Now keep a blanket on the seat of the chair. Keep one more blanket in front. We are going to do some more postures for the upper back in the sitting stance. So sit in Vajrasana, sit on your heel, join the big toe, join the knee, sit on the heel right in front of the chair. Chest and navel up, sit upright. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. This is Vajrasana. Very good for the foot, the ankle, knee. Now here, inhale, exhale. Turn to your right side. Keep the right hand on the chair, left hand on the right knee and turn. Chest and navel up. A gentle twist for the complete trunk. In all this twisting, you should also turn the neck in the direction of the twist. Slowly come up. Then chain. Right hand on left knee, left hand on the chair. Use the grip to turn the trunk. As you inhale and exhale, feel the pelvis, the abdomen and the chest. Slowly come up. Sit upright. Hold the seat of the chair. Slowly recline back and then stretch your arms between the ribs of the chair. Keep the arms straight and neck relaxed on the seat of the chair. As you may see, even here there is a good amount of backward bend for the upper back. Keep both arms straight. Feel the complete chest cavity. Do not hold the breath. You are sitting in Vajrasana and experiencing a good stretch for the upper back, a good extension for the upper back. Feel the center of the chest, feel the diaphragmic region, feel the abdominal region, feel the pelvis. Be seated firmly on your heels. Both arms straight. Get completely involved with the posture. It is very essential. Get involved with the posture, with the breathing. The advantage of the chair is that you can position the upper back properly, you can get a good stretch, you can stay for long, you can experience the posture much deep. The use of props should provide you better penetration into the posture through the faculty of the mind and the breath. You can keep the eyes closed, go deeper, watch your breathing, feel the stretch in the thoracic region, the lower, middle and upper thoracic. The complete spectrum gets a good stretch. Now flex the arms and then slowly get up, sit upright. As you know, the chest houses vital organs. So these things are very useful to stretch them. Now fold the blanket below the chair and sit upright in swastikasana, cross-legged, hips on the folded blanket, foot on the mat. Now inhale, exhale, turn to your right side, left hand on right knee, right hand on the chair, twist the trunk. And all this twisting definitely engages the thoracic or the upper back. Turn the neck also. As we inhale, abdominal cavity should expand. As we exhale, it should contract. A gentle twist. Feel the upper back as we inhale and exhale. Slowly come up. Sit upright, then change. Right hand on left knee, left hand on the seat of the chair. Use the grip to twist the trunk completely. Even when you twist, you should ensure to lift the chest and navel up so that the spinal column should not shrink in length. And you should twist and use the breath. Slowly come up, sit upright. Now from swastikasana, hold it over the chair, slowly recline back, resting the head on the chair, stretch the arms, stretching them into the ribs of the chair, both arms straight. Relax the neck. Feel the upper torso. Diaphragm divides the chest and the abdominal cavity. So feel them. The bottom of the chest, middle of the chest, top of the chest. Especially the stretch in the top of the chest is very important. Upper thoracic is not easy to stretch. And use of the chair would enable us to even stretch those regions. Keep both arms straight. Both the lungs and the heart, especially the lungs, there are many air tubes which are very minute in size. They all get a good stretch. Similarly, the cardiac system, a lot of tiny blood vessels which all would get a good stretch. And it is important to retain the elasticity in these systems. The arteries or the blood vessels or the air tubes in the lungs should not become rigid. Slowly come up, sit upright. Sit in Baddha Konasana, join the foot and push the knee down, chest and navel up. That's Baddha Konasana. Baddha Konasana helps us to open the base of the pelvis better. Inhale, exhale, turn to your right side. From left hand, hold the foot, right hand on the top of the chair. Inhale, exhale, turn. Chest and navel up and twist. Breathe well. In Baddha Konasana, you can feel the base of the abdomen, the pelvis, the lowermost portion of the trunk more effectively. As you inhale, the abdomen and the pelvis should gently expand. As you exhale, they should contract. Slowly come up. Change side. From right hand, hold the foot, left hand on the seat of the chair, inhale, exhale, twist. Lift the trunk and navel up, gently twist. Turn the neck also in the direction of the twist. The positioning of the legs would enable to access various muscles. Slowly come up. Now hold the top of the chair and gently lean backward. Stretch the arms between the ribs of the chair. Stretch well. Chart the knee towards the floor. Keep the foot pressed. Arms stretched. Breathe well. Initially you may keep some padding, or that is one more blanket maybe below the head in case you are not able to rest the head. But do not hold the breath. Stretch the arms. You have to stretch the arms intensely so that the armpit region and the region of the upper chest gets a very good intense stretch. Here you can see that the pelvis and the abdomen, especially the pelvis, experiences a better opening and better stretch. Feel, get involved, go deeper into the posture. Feel the upper back, feel the region of the clavicle, the region below the clavicle or the collarbone, the center of the chest, the sternum. Feel the ribs. Feel the stretch in the region of the lungs and the heart. Feel your abdominal region. Feel your pelvis. Feel the groin. Now flex the elbows. Slowly come up. Stretch both legs forward, chest and navel up. Fold right leg to the side, then the left leg also to the side. Vajrasana, or the soldier's posture. Hips at a height, chest and navel up. Join the knee. Foot should run in line with the leg. Inhale, exhale, turn to your right side from left hand, hold the right knee, right hand on the seat of the chair and twist. Chest and envelope. Vajrasana is excellent for the muscles of the lower extremities, that is the legs. It gives an internal rotation both for the hip and the knee. A good plantar flexion for the ankle joint. Slowly come up, change side, right hand on left knee, left hand on the seat of the chair, turn. Turn the neck also in the direction of the twist. Chest and navel up, feel the trunk. Especially focus yourself on the upper back, the thoracic region. So these different sitting postures would have the benefit of triggering various muscles, both in twisting and backward bending. Slowly come up, sit upright. Now hold the top of the chair, recline backward, stretch both arms into the loop of the chair. Ensure that you are seated. The hips should be seated so that you can feel an intense stretch, especially in the thoracic region. Head relaxed on the seat of the chair, arms straight. Keep on stretching, intensify the stretch. Feel your upper arm, feel the region of the armpit, the complete thoracic cavity, both the top, the sides and the back of the thoracic region. We are doing a good backward bend, extension for the upper back in Vajrasana. Feel the stretch in the abdomen and pelvis also. Breathe well. Feel the stretch. Always note that the positioning should be proper. The position of the chair and the distance at which you sit, they are all very important in these kind of postures. Flex the elbows, slowly come up, sit upright. Stretch both legs forward. We are trying to give the twist and thoracic bending in different sitting postures. Now fold right leg, roll the calf muscle, pull the heel closer to the abdomen, left leg straight, sit upright. This is classical Padmasana. Stretch your right leg, change side, left leg. Roll the calf muscle from right hand, pull the left heel into the abdomen, Push the left knee down, right leg straight. Stretch your left leg forward. Right leg Padmasana. Pull the heel as close to the abdomen as possible. Heel in fact should press the abdomen. Then again pull the left hand also. Pull left leg also. Padmasana. Now inhale, exhale, turn to your right side, left hand on right knee, right hand on the chair, turn. Padmasana is a very stable posture, very acclaimed posture for many meditative practices in yoga. Breathe well. Feel the upper back, feel the lower back, the sacrum, feel the region of the tailbone. Slowly come up. Change. Right hand on left knee, left hand on the seat of the chair, inhale, exhale, turn. Note that the hips are at a height. That is because it will enable to keep the spinal column straight. Chest and navel up. Twist well, breathe well. Slowly come up. Now we are going to bend back. Bend back. Then stretch both arms. Both arms straight. Arms between the ribs of the chair so that you can stretch better. Tighten the muscles of the upper arm. Feel the armpit. Feel the center of the chest. Padmasana helps to intensify the stretch on the lowermost portion of the trunk and the pelvis. Feel the legs. Padmasana gives a good external rotation for the hip and the knee, a good flexion for the knee. And in this posture we are also stretching the upper back. Feel the rib cage. These postures greatly help the upper back and the organs contained there. Slowly come up, stretch both legs forward. We are going to change the order in Padmasana. Now left leg up first. Pull the left heel into the abdomen, followed by right leg on top. Sit upright. We are changing the order of the legs in Padmasana. Inhale, exhale, turn to your right side, left hand on right knee, right hand on the chair, turn. Breathe well. Slowly come up, then change side. Turn to your left side, right hand on left knee, left hand on the chair. Inhale, exhale, turn. Feel the complete length and breadth of the spinal column. And today, especially focus on the upper back. slowly come up. Sit upright. Now hold the seat of the chair from both hands. Slowly recline back. Then stretch the arms between the ribs of the chair. Push the knee towards the floor so that you can feel an enhanced stretch in the complete trunk. Padmasana is excellent for the health of the lower extremities, the foot, ankle, knee and hip. They all get a good benefit. You can feel a good stretch in the pelvic cavity, abdominal cavity, and a very intense stretch in the thoracic cavity. The role of the arms not to be neglected. Keep them intensely stretched. So not only the arms get benefited, but they in turn help to stretch the upper back better. And ensure to rest the head properly. Do not strain the neck muscles. Do not hold the breath. Breathe should be slow and steady. You must feel the posture, feel the breath. Staying in the posture is very important because the finer systems that we have need some time to accommodate. Very good for the upper back region. The ribs, the intercostal muscles, the internal intercostal and external intercostal muscles, they are muscles of respiration. They also get rejuvenated in this posture. Flex the elbows, slowly come up. Then stretch both legs forward. Sit upright in Swastikasana. Just watch your breathing, watch the upper back, watch the center of the chest. Be relaxed. Just feel the center of the chest. Namaste.